As a nurse educator and administrator, I know the professional parent partnership is essential. We need to speak the same language to get our kids the help they deserve. In Chapter 11, I give you some insights to help with communication. Here's an overview and tip for your next doctor's visit. Communicating with doctors within healthcare settings can be challenging. For purposes of this chapter, doctors are referred to those in healthcare professions such as pediatricians, primary care physicians, or mental health professionals, such as psychiatrists or psychologists. There are a few factors that may pose a barrier to your communication with doctors. Some of those factors may be misinterpreting or misunderstanding the medical terminology, the processes of policies and procedures, and the inability to effectively communicate your main concern. These barriers may lead to frustration for all parties and delay the care or treatment plan for your child. Since most doctors have limited time to discuss concerns during an appointment, it's important to communicate what you need quickly and effectively. You want to make sure your child is a part of the decision-making process with their doctors if they are age appropriate. Here is tip number 1. Identify the main concern and state it briefly. For instance, my child's behaviors have increased despite the medications prescribed, or I'm concerned that the child may be showing signs of anxiety as noted by his pediatrician. And a quick overview and tip for schools. Communications with schools can be done in similar ways to doctors. You want to ensure your communication methods are positive and you work as a team with the schools to meet your child's goals. Prior to communicating with the schools, it's important to understand your parents' rights. You want to review any policies and procedures that are consistent with your plan to discuss with them. So here's tip number 1. Communicate your concern in writing. It can be in the form of an email or letter. Save communication records to recall interactions and validate decisions. You don't have to guess what to say. This chapter focuses and features communication templates and real-world examples that you can copy and use immediately. Like all chapters in this workbook, there are practice questions and reflection exercises to prepare you before you ever step foot into a meeting. Start navigating these professional spaces with confidence. Both my memoir and workbook are now available at a new lower price on Amazon, and the link is below.